Today, we will take a look at the many voice diagnostic methods. The idea of making a scientific approach to our playlist 1 is to update the possible evidence for medical voice diagnostics after our 2012 Cochrane review on hoarseness. This playlist is based on British Library Search from 2012 and onwards, European Manual of Medicine, Phoniatrics 1, UEMS 2020, specific updates with links to papers and PowerPoints from mpedersen.org. The referred papers are our choice for educational purposes. This is an overview of following videos, of which are meant to be a tutorial. We have taken PowerPoints and papers from our homepage with examples for use. The synopsis will be divided into 3 parts, focusing on 1. Traditional measurements, 2. Vocal fold movements, and 3. Laryngopharyngeal reflux score. These areas covered within traditional measurements are subjective complaints, acoustical analysis, and airflow. We have used all of the above-mentioned methods during the course of many years of practice. Many of these are still in use today, some have been refined, but the field is still in need of new methods to evaluate symptoms. Airflow is still used in many places, though mostly in specific research projects. The first reference is of our 2012 Cochrane review. This is relevant because we at the time searched for evidence-based papers on voice measurement. Of the 179 papers, none of them fulfill Cochrane's criteria for evidence-based research. Narrative description of cases is not evidence-based research. This is why we decided to search British Library from 2012 and onwards in order to find relevant papers, at best randomized control trials. The problem with stroboscopy has from the beginning been quantification due to the fact that stroboscopy doesn't record all pictures, but a reduced amount of duty cycles of the vocal folds during intonation. Therefore, we synchronized electroglottography with stroboscopy in a way that the electroglottographic curve was marked on the stroboscopy, and it was possible to choose the preferred phase of the duty cycle. Fortunately, many studies have been made on stroboscopy, though it is very difficult to quantify. The literature on high-speed films, which is the latest possibility to present the real-time vocal folds. There are programs that can help quantify high-speed films, and this will be discussed in later videos. American Academy of Otolaryngology has a separate guideline for hoarseness, also called dysphonia. Dysphonia is a very common complaint that affects nearly 1/3 of the population in some point in their life. The American Academy of Otolaryngology have made an overview of diagnosis and treatment. In their overview, only 2 of the diagnoses are referring to high-quality randomized control trials. In the field of vocal fold movement, stroboscopy was where clinical description of movement started. This was limited by the fact that it was only recording with 25 frames per second, but it helped give a visual representation of the vocal fold movement. We combined electroglottography with stroboscopy in order to see the true movements in real time. When high-speed film became available for clinical use, we bought it early on. It replaced stroboscopy since it recorded 2000 frames per second and upwards. Since the vocal folds move 110 times per second for men and 220 for women in average, this was the first time that we directly could observe the vocal fold movements in real time in the clinic. Along with high-speed films came various analysis of the recording, such as chomography, segmentation analysis, and electroglotography. All of these were routinely used in the clinic and will be presented in the respective videos. The advantage that high speed has over stroboscopy is reported in the European Manual of Medicine Phoniatrics 1 from 2020, where the authors state that high-speed video laryngoscopy is therefore always indicated in cases where the voice is so severely dysfunctional that stroboscopy cannot be reliably triggered. And in a comparative study from 2019, in which it states that change in function could be obtained in more patients and for more parameters using high-speed video than video stroboscopy. Laryngopharyngeal reflux score is a tool for medical doctors to help them map the improvements in patients. We score each symptom and finding separately because it has shown to be extremely important in the daily work with patients. They respond positively to these tools. These tests have been in clinical use for many years, as well as the basis for many research papers. Reflux Symptom Index is evidence-based as a questionnaire. In our own randomized control trial, we found the questionnaire for laryngopharyngeal reflux made by Jamie Kaufman evidence-based. We also found that the diet is of importance. High-speed film gives information quantitatively with segmentation. There is nearly always insufficient closure in the rear area of the vocal folds, apart from the edema of the arytenoid region. In the European Manual of Medicine, Virginie Wassar concludes, mandatory laryngoscopy, several laryngeal and vocal risk factors are often present in voice disorders, highlighting a frequent multifactorial context. On the subject of diet, Deschamps concludes in a 2018 review and meta-analysis. This meta-analysis supports a mild superiority of proton pump inhibitors over placebo and the importance of diet as additional treatment. The relationship between Helicobacter pylori is discussed by Campbell in a 2017 review and meta-analysis, in which there is found that Helicobacter pylori eradication therapy has been successful at significantly reducing some of the symptoms of laryngopharyngeal reflux. Cough is a separate problem that sometimes are linked to neuromedicine, lung medicine, allergy, environment, psychiatry, etc. We have decided to present Jamie Kaufman's scheme. We use it occasionally, but usually the cough disappears along with reflux treatment. In most cases, it's a good idea to advise people on the function of the voice, because in many cases they develop bad habits due to the laryngopharyngeal reflux. The awareness helps them make lifestyle adjustments. Thank you for watching, and we'll see you in the next one.